Hello and welcome. Today I'll be looking at a topic called hypoglycemia or low blood glucose. You've heard the phrase, a hungry man is an angry man. There's an element of truth in that because hypoglycemia or low blood glucose or very severe hunger can affect the brain. So a hungry man can truly be an angry man. But I'll go a step forward by saying that an extremely hungry man, in other words, somebody that develops hypoglycemia, can actually become dead. And that is really very important. And so if you're watching this topic today or listening to this video, please be aware that it's not only for patients that are diabetics, but also for everyone that can be in a position to at least assist in preventing somebody from dying from hypoglycemia. In previous videos, I've looked at diabetes type 1, type 2, part 1 and part 2 of diabetes, and I would encourage you strongly to watch those videos. In diabetes mellitus, we talk about high blood glucose, which is hyperglycemia. So when we say hyper, it means excessive. If we say hypo, it means something that's too low. So in diabetes, we're looking at hyperglycemia, but the problem is that in treating the hyperglycemia, there could also be hypoglycemia, in other words, reduced blood glucose. It's also important to mention that hypoglycemia is a medical emergency. And this is one of the conditions that we really need to do something very, very quickly, urgently, because if we don't, patient can become brain dead, and that can have very, very serious consequences. And so it's also important to note that being a medical emergency, this is one of the conditions that can be really, really very rewarding. If you do the right thing, the patient can literally come back and you're just so amazed to see the results, the outcome of your treatment within a few minutes. So why do people become hypoglycemic or develop low blood glucose? We're going to look at these from two aspects. On one hand, hypoglycemia, low blood glucose occurring in people that are diabetic, and then hypoglycemia, low blood glucose occurring in people that are non-diabetic. Because think about it for a moment. We do all go through periods of being hungry, but we don't develop hypoglycemia because the body has mechanisms for ensuring that the blood glucose level is within a certain threshold, a certain range. So why then do people develop hypoglycemia? So the first part, in those that have diabetes, why would hypoglycemia occur? Number one, in the treatment of hyperglycemia, which is diabetes, patients may develop hypoglycemia. Why does this occur? Number one, if the dose of the medication we are using, say insulin or metformin or whatever medication we're using to treat. Now, metformin on its own may not necessarily cause hypoglycemia, but the one that will really, really be concerning is use of insulin. If you're using insulin, the dose may either be too much, and when that happens, you will develop or are predisposed to developing hypoglycemia. Number two, if you've had the insulin and you skipped a meal or delayed eating, that may also predispose you to developing hypoglycemia. And then if you eat inadequately, not enough carbohydrates in your meal, there is also a chance you could develop hypoglycemia. And then exercise. If you carry on doing unaccustomed exercise or exercise that is excessive, or not eating adequately before carrying on with exercise, or not reducing the dose of insulin before starting exercise, you may be predisposed to developing hypoglycemia. And then if you drink excessive amounts of alcohol, particularly without eating, you may also be predisposed. And why does that happen? Because when you drink excessive amounts of alcohol without eating, alcohol can suppress, inhibit the ability of the liver to produce glucose. So what I've said so far is the category of patients that are diabetic presenting with hypoglycemia due to use of insulin, not eating adequately, missing their meals, delayed eating, and then excessive amounts of alcohol. And then those without diabetes, how does hypoglycemia occur in those without diabetes? Number one, malnutrition, prolonged lack of adequate nutrition. either you're not eating adequate amounts of nutrition or food, or you're not eating rightly. And then number two, patients that have a condition called Addison's disease. Just assume for a moment this is the kidney. Overlying the kidney, there's a small structure there called the adrenal gland. The adrenal gland, one of the hormones that's produced by the adrenal gland is called cortisol. If the amount of cortisol is reduced, or because the adrenal gland is diseased, there's an inadequate amount of cortisol, the liver is unable to produce glucose, and so the patient goes into hypoglycemia. And then, if there is a tumor of the pancreas, remember in the video on diabetes, I mentioned that in the pancreas, you have the islet cells of Langerhans that produce insulin, but you also have other cells that produce glucagon. Now, if the cells that produce insulin, there is a tumor there, they will produce excessive amounts of insulin, and so the body runs into a situation where the amount of insulin is excessive, and so will cause depletion in glucose level and cause hypoglycemia. And then medications such as beta blockers that we use in treating hypertension, and then quinine that is used in treating malaria, can predispose patients to developing hypoglycemia. So which is worse, hyper or hypo? Hyper will occur in diabetes. Hypo will occur as a result of either treatment or disease states. So which is worse? Well, both of them are bad, but I can tell you that hypoglycemia is actually worse. The reason why it is worse is that hypoglycemia is more likely to damage the brain within a period of time compared to hyperglycemia. I mean, both of them are bad. Hyperglycemia, if not adequately treated, can lead to death. Hypoglycemia can lead to death, but the problem is that within a short period of time, because of the amount of glucose required by the brain, if there's not enough glucose over a prolonged period of time, it can result in brain death. And so the patient is alive, but the function of the brain is severely damaged. So hypoglycemia is a medical emergency, it requires adequate and urgent treatment. So what are the symptoms of hypoglycemia? Remember, we've said at the beginning that truly there's some element of truth that a hungry man is an angry man. So one of the areas that hypoglycemia can affect is the autonomic nervous system. Autonomic nervous system. This is a part of the peripheral nervous system. What this does is, just picture for a moment, your heart beats without you doing anything. So there is a part of the nervous system that is responsible for the involuntary physiologic processes such as your heart rate. So hypoglycemia or low blood glucose can affect the autonomic nervous system, presenting with sweating, palpitation, trembling, shaking, and then it could also affect the brain, resulting in irritability, slurred speech, poor concentration or difficulty with concentration, and drowsiness. And then it could also cause fatigue and weakness. How do we make a diagnosis of hypoglycemia? The symptoms I've enumerated so far, and then blood sugar check. But I need to mention that hypoglycemia is a medical emergency. There's not enough time to, wait for results to come back and then you don't have the luxury of time. You've got to do what you've got to do as quickly as possible. It's a medical emergency. And so what do you do then? You've got to sometimes use your clinical judgment. And that brings us to how to clinically make a distinction between hypo and hyperglycemia. Now, in hypoglycemia, you're more likely to have blood pressure that is raised. The pulse is more likely to be bounding. Patient is more likely to be sweaty, and then hyperreflexia, which is an exaggerated reflex response. So these are clinical signs that you could easily detect by just examining the patient if you're a doctor. But if you're not a doctor, excessive sweating can actually be a presentation in hypoglycemia. So what do you do? A number of times we can actually treat and then wait for the result, because by simply treating the patient, you will know and see the result right in front of you, because that patient that was either unconscious or quite drowsy, as soon as treatment starts, will pick up very quickly. So the treatment, we can divide this into, if the patient is conscious but hypoglycemic, And if the patient, on the other hand, if the patient is unconscious with hypoglycemia. So for a patient that is conscious, you could easily take a sugary drink, biscuit, glucose tablets, or glucose powder. And within a short period of time, you will notice that there's resolution of symptoms. Now, it becomes different if the patient is unconscious, so you can't help yourself. And that's why it's important for people around you to know what is going on. The first thing is to avoid putting any food through the mouth if the patient is unconscious. The reason is because in the unconscious state, if you put things through the mouth, that patient can aspirate. In other words, that food or whatever you put into the mouth can go into the wrong passage and cause more problems. And if somebody has some degree of medical education, if there's a medication called glucagon, it can be intramuscular glucagon that can be injected and that will produce the result. Now, remember, I said that in the pancreas, there are cells that produce glucagon, whereas insulin brings down glucose, glucagon replenishes glucose. So if you're able to inject that patient with glucagon, you will produce glucose in the circulation and the patient becomes fine. However, in the hospital environment, you're more likely to have glucose infusion and there will be quite remarkable resolution of symptoms. And once the patient is conscious, the patient can drink and eat food. Drink water, drink something sugary, and then eat food. So how do we prevent hypoglycemia from occurring? Very important. Number one, if you've been diagnosed with a condition called diabetes, don't conceal it from your family and very close friends. The reason being that if there is an emergency, they will know what to do. But if you hide this information from them, they all will be confused, and that can really lead to a loss of time. Number two, family members need to be educated and close friends on how to treat hypoglycemia. They need to have some basic knowledge on what to do. Could just be, once the patient is drowsy, getting some food into the mouth or getting some sugary drink. But remember, if he's unconscious, do not put food into the mouth. Number three, don't adjust your medications without guidance. You need to be guided adequately to make any adjustments. Number four, if you're diabetic, carry biscuits and sugary drinks alongside. And you could also take alongside with you intramuscular glucagon if it's provided, or carry a medical ID that shows that you have so conditions, so that in the case of an emergency, people can easily have a look and know what to do. And then you should also avoid excessive or unaccustomed exercise. That's really very key. And if you're going to engage in exercise for a prolonged period, it's important that you reduce the amount of insulin or increase the amount of carbohydrates you eat. I advise that you have a glucometer. A glucometer is a small machine that you can use to check your glucose level, so that you be a part of monitoring your glucose level, so you don't have situations where it drops remarkably. And then avoid skipping meals, and then reduce, like I've mentioned before, insulin before exercise. If you do these things, you're most likely going to avoid a situation where you run into hypoglycemia with a state of unconsciousness. If you've learned something in this video, like, share, and subscribe. Thanks and bye.